Hi everyone, if you're over 40 or approaching, you need to know about cholesterol, especially for those with dyslipidemia. Managing cholesterol involves healthy eating, exercise, quitting smoking, and possibly medication. High cholesterol increases heart attack and stroke risk. Effective treatments are available. Guidelines focus on lowering LDL cholesterol to reduce risks. What is blood cholesterol? Two main types: HDL, good, and LDL, bad. LDL forms plaque in arteries, blocking blood flow. HDL removes excess cholesterol. Saturated and trans fats raise cholesterol more than dietary cholesterol. How do you know if you have high cholesterol? Testing is recommended for men over 40, women over 50, or those with heart disease, diabetes, or high blood pressure. Lowering LDL cholesterol benefits those with coronary heart disease. After starting statins, LDL is rechecked. A second medication may be added if needed. You'll see numbers for HDL, LDL, non-HDL cholesterol, and triglycerides. Aim for higher HDL and lower LDL levels. Familial hypercholesterolemia increases early heart disease risk. Consider genetic testing and early treatment. After a heart attack, patients start on high-dose statins and lifestyle changes. High triglycerides also increase heart disease risk. They need to be assessed on a fasting blood test. Dietary changes and exercise can lower triglycerides. People with diabetes are at high risk of heart disease. Statins are recommended. Lifestyle modifications include drinking water, cooking at home, and choosing healthy options when eating out. Control ingredients and portion sizes at home. Make eating out a special occasion and choose healthy options. Maintaining a healthy weight is key. Being overweight can increase LDL and lower HDL. Stay active with at least 150 minutes of exercise per week, and quit smoking to improve HDL. Check nutrition labels for sodium and trans fat values. Aim for less than 15% daily value for fat and sodium. If lifestyle changes aren't enough, your doctor might prescribe medications like statins. Statins are effective for lowering LDL and preventing heart disease. They decrease cholesterol production and increase removal by the liver. Statins can also reduce inflammation and prevent heart attacks and strokes. Most people tolerate statins well, but some may experience muscle pain. Ezetimibe blocks cholesterol absorption and is often used with statins. Speak to your doctor and know what dyslipidemia is.